Good morning and welcome to the regular session of the Board of Supervisors meeting for August 12th. Roll call, please.
Grant.
Here.
Schwartz.
Here.
Leyland. Here. Kurttenbach.
Here.
Hall.
Here. Please join for a moment of silence to reflect on this morning's actions. Please stand if you're able to join for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item 1, agenda received as proposed or as amended.
Second.
Got a motion and a second. All in favor say aye. Aye. Motion carries. Item 2, public comments. This is a time on the agenda for anyone to speak on an issue that is not on today's meeting agenda, either in the room or online.
Hi, my name's, I've never been here, so I don't know.
You could just come up to the podium if you could state your name and address.
My name is Keith Reese. My address is 1023 West 2nd Street. I'm the owner and president of Rising Real Estate. So I just noticed recently there was an order for dismissal for a contempt of court for a felon that forged a court document. So I'm just here wondering why someone, can forge a court document, write a bad check, and somehow is still free, living his best life when in court the judge tried to give me 30 days thinking the document was forged by me, and then once she realized that it was forged by the other person, she let the guy go. And they've decided that they're not going to press charges. So I'm just here wondering, this judge actually quit, so I'm just wondering, what are we doing about this? Have you guys heard about this? The case is SCSC 1945-85.
What was the number?
1945-85.
We can reach out to the county attorney and see if.
Okay, I have some documents for you too. I'll just give it to you. All right, you guys have a good day.
Thanks, Keith.
Thank you.
All right. Anyone else, either in the room or online? Seeing none, we'll move on to item 3, years of service to employees with 20 or more years of service to the county.
The county would like to recognize a few employees with several years of employment to the county. The first one is Chad Hagerty, who has 30 years of service with the Sheriff's Department. Sheriff Knapp will be accepting in his place.
Yes, we're actually getting our medical accreditation survey today, so Captain Haggerty is the jail administrator, is tied up with them pretty much all day today and tomorrow, but thank you.
I'm good.
Yeah, thank you.
That's always open.
And next, want to recognize Tasha Anderson Holmes with 25 years of employment experience with public health. Congratulations. They might want to say congrats.
Yes.
Congratulations.
Thank you.
Congratulations and thank you.
Thank you.
Thank you.
Thank you. Of course.
Yeah, and if I may, I just want to say a few words about Tasha, Caitlin Everett, Public Health Director. So Tasha works in our Public Health Center as a dental assistant and has been a very core and consistent person in our oral health program for many, many years. I have a note from Tanya Wilder, our Public Health Center manager. She says, Tasha consistently demonstrates commitment to her team and program objectives. She understands the importance of the vision, embracing change as an opportunity towards progress and as a means of innovation. Thank you for the many impactful contributions you have made in the pursuit of improved child and adolescent oral health. And I would just add to Tanya's comments that Tasha is the kind of person that, yes, sees the mission, sees the vision, sees what we need to get done, cares very passionately about the children that we serve, and also is an extremely hard worker. She comes to work, she does what she needs to do, she guides other people along the way, and helps coach and mentor others. So thank you for your service, Tasha.
Well, thank you.
Thank you.
And last but not least, Linda Hensman, 20 years of service with the county treasurer's office and our county. Thank you. Thank you. Thank you. Thank you.
Very good. We'll move on to item 4, claims and payments. This is a resolution that the Board of Supervisors approve expenditures and that the county auditor be authorized and directed to issue payments against the various settlements of such claims as law.
So moved.
Second.
Good morning, Board. Our total bill payment today is $1,375,473.44. We are also paying out of that from the sheriff's 60/40 fund, $2,553.40. We do have some larger payments today. So they're pretty much from the ARPA fund. Peters Construction, we're making a payment on the IT server room renovation of $33,195.56 cents, And also for the Pinecrest HVAC replacement project, $510,952.97. And also to Young Plumbing for the HVAC project in the jail, we're making a payment of $33,856.78. We are making a large payment to Connolly Construction for the Washburn Sewer valve improvements, $78,187.61, and that will leave only retainage on that project. So it's exciting to see the ARPA projects moving along. And I think those are the only unusual ones today. Questions for me? Everything appears to be in order.
Michelle, the question I had this morning on is that part of this or is that part of the interjournal?
Well, it's, you have certain payments that the board takes action to allow departments to approve throughout the year without coming to you for approval first. Payroll-related items all fall within that category, and so there is a really large list today of manual checks, and I didn't get it sent off very long before this meeting, but I did ask about that just to make sure those are all appropriate.
Okay.
I'll forward that to all the board when we get a response.
All right, we've got a motion and a second. Roll call, please.
Kurttenbach,
Yes.
Schwartz,
Yes.
Grant,
Yes.
Leyland,
Yes.
Hall.
Yes. Item 5, receive project updates from department heads and elected officials.
Good morning, Board. Kathy Nicholas, engineer. Just a brief update on a few things. We are still cleaning up tree debris. This does mean that we have moved the limbs and the trees off of the road. They are in the right of way and we just need to get them out of the right of way. We are mowing the hard surface routes. We will continue to do that through the holiday into September. And then we are going to start mowing the gravel roads on Monday. We've had a mower or two out of commission for a few weeks, so we do have that back in service now. And tomorrow we are setting our bridge beams, so this is a good opportunity if you'd have a chance tomorrow, probably most of the day tomorrow, to come out and see how we move these 16, 17 ton beams. There's 4 beams that make up a bridge, to move them into place we move them out from the Longfellow shop, which is where they are, now out to our bridge site on Mount Vernon Road. So in the vicinity of the airport, or just north of the airport, is where that project is going on. If you'd like to see that, please let me know. I'll let Ryan know. We'll be able to probably meet you out there. And then lastly, Iowa did submit the competitive highway bridge program application that did get submitted by the Service Bureau grants coordinator, that did get submitted to the federal government. And we are hoping to hear something by December. And again, that was for our replacement of our a bridge on Eagle Road. Can I answer any questions at this time? Thank you.
Okay, how late, would be too late to go out there, I won't be available till 4.
Probably like 2:30, 2 or 2:30. Yeah, let us know if you're interested.
Alright, don't see any else in the room or online, we'll move to item 6, minutes approved for the August 5th meeting.
So moved. Second.
All in favor, say aye.
Aye.
Motion carries. Item 7, the consent agenda. The items below will be acted upon with a single resolution without separate discussion unless someone from the board or the public requests that a specific item be considered separately.
So moved.
Second.
Roll call please.
Schwartz,
Yes.
Leyland,
Yes.
Grant,
Yes,
Kurttenbach,
Yes.
Paul.
Yes. Item 8, a resolution to approve amendment to the NAFCare contract that modifies the staffing matrix as follows. Reduce the psychiatric nurse practitioner position from 1.2 FTE to 0.5 FTE and add a mental health professional position, 1 FTE, resulting in a cost savings of $41,416.66 over the life of the contract, and to allow NAFCare to substitute 1 hour of doctor position psychiatrist with 2 hours of NP, PA, or Psych NP, PA time as needed as recommended by Nate Neff, County Sheriff.
So moved.
Second.
Morning, Board. Nate Neff, Blackey County Sheriff. I was talking to NAFCAR about ways to possibly get our contract down a little bit. I was hoping to go a lot more than $40,000 over the next 2 years, but it's a start that I'll keep working on. As far as reducing the psychiatric position, I was more than a little concerned to start with that, but then once we broke it down, right now our Psych NP is actually seeing patients around 14 to 15 hours a week on average. The rest of her time, she's doing follow-ups on paperwork, follow-ups on exams, suicide watches, that kind of things. Things that can be done by either a mental health professional, which can either be a social worker or a nurse. So by doing this at a cost savings, we're still gonna be seeing the exact same amount of patients, possibly even giving her a chance to see a few more patients. And then we'll have, whether they find a nurse or social worker to do all those other tedious tasks that they won't. So it's actually, we're going from 1.2 FTEs to 1.5 FTEs. Should give us more actual clinical time and still a cost savings on it. So I think that's a win-win there that I'm more than comfortable with. And then they asked about the other part where if they can't get a doctor in to use an NP at a 2-to-1 rate. I know anytime anyone in my family or I go to the doctor or the clinic, urgent care, I don't know when the last time was I saw an actual doctor. It's almost always an NP. So the level of care there, it's good enough for me, it's good enough for my family. I think it's good enough to people across the street. Obviously, if there's something we need to see a doctor for, we'll get them to a doctor. But as far as basic health care, honestly, I kind of hope there's times where they can't get a doctor in and they have to give us 2 hours of NP because they're going to see that many more patients and have just as good a coverage. So again, I think that's a win on our part there. So both parts of this amendment, I'm more than good with. I think it actually benefits us at a cost savings. So.
Nate, a quick question for you. Looking at the contract, from 24 through 25, it was like 205,825. But looking at June and July, they're coming in about 207,000 a month. Are we getting charged more because we're having to hire people in there?
Yep.
Care
So
needed?
our base rate is based off of 250 inmates, which is usually right where we're around. The last several months we've been above that, so then there is a per diem, and I forget exactly what it is. I think it's probably in there. But each day that we're over 250, we get charged a little extra. So.
Yeah, and then this past month, we were supposed to be contract 216, it came in at 217. Just kind of wondering about that. Again, if it's just, we have extra people in there,
Yeah,
that's a cost.
up to 250, we pay the same rate, and then there's a per diem. And
Above that.
it's one of the first things Chad does every day is he goes in the morning as a jail administrator, checks what our ADP is, average day of population, and he sends that to them. So at the end of the month, we do get billed a little bit more for any day we've been above 250, which unfortunately has been more than not here recently.
Alright,
Is that even if they're not having any contact with the people that are in over that 250 cap?
Correct, yes.
Oh,
Yeah, we don't get billed per service, it's a flat contract rate, so.
okay.
Which, I mean, they have contact with every inmate that comes in, they do the exam, they come in.
Yeah.
Within 4 hours of being brought into jail, they're screened by medical. Then there's follow-up within 10 days on it, so they actually do have contact with every inmate that comes through at least twice in the first 10 days. And then from there, I mean, over 50% of our inmates are on just psychiatric meds, and then you throw in the other med stuff. They're seeing the vast majority of people up there anyway. There has to be a dental screening done, and if they stay for a year, there's an annual dental screening done on every inmate. That often too, so.
Okay.
So they're seeing them, and then they hold the liability of if anything does happen, because we're one of a few contracts where most places, if we have to take them to Allen for whatever, the county eats that cost. Part of our contract with NAFCARE is they eat all those costs. When there's, whether it's dentist runs, any other runs, hospital runs, that kind of stuff. So they're holding that liability on every one of those inmates, whether they're taking advantage of it or not.
If somebody's brought in and then turned away because of medical, and this was me last week, that's why I missed the meeting last week, because I was dealing with something like this, but so spent half the morning at the hospital with somebody, but like because of a complaint of chest pain. So does that fall back on them then?
No, if we haven't accepted them, then that falls back on, like, say they were injured during arrest, that would be up to the person to be,
Yeah.
whether they took that up with the police department or their own insurance or their own tab. A case like that where it's chest pains, if we haven't accepted them, it's not on our bill, it's not on NAFCARE's bill. And that's why, and I know this is one of the few things we still butt heads with on the PD fairly frequently is the turnaways, but that's it. Once we accept that person, we accept all that liability.
Right.
We accept everything that goes with it. So that's why they're pretty adamant on somebody comes in with a head injury, somebody comes in complaining, somebody comes in so drunk they can't stand. You know, when I started, if somebody came in with a 300 blood alcohol level, we kind of threw them in the corner and checked on them periodically, and we were good. Now we make sure that person gets treated and that they're not going to code on us.
Yeah, I think most people understand it. It is what it is, so, and there's a reason for it, so it makes sense.
But yeah, those people don't fall under NAFCARE's bill, or theoretically not under our liability. Obviously, if something happens, anybody can be named for anything. But
All right, cool. Thank you.
any other questions?
Thank you.
Thank you.
It's a resolution, roll call please.
Buck,
yes.
Leyland,
Yes.
Grant,
Yes.
Schwartz.
Yes.
Paul.
Yes. Item 9A, a resolution of the proposal received from Base Point Building Automations of Des Moines, Iowa for HVAC system modernization of the courthouse in the amount of $106,600. Be approved and for the chair to sign as recommended by Lori Gibbon.
So moved. Second.
Good morning, Board. Rory Giving, Facilities Director. This is a FY '26 budgeted item. What this consists of is changing out what I call the head-end system of our building controls here at the courthouse. It's our master controller. In fact, the existing controller right now is not functioning, and so we're some sort of running with our blindfolds on in the building right now. And so this is why we budgeted for this. We were hoping to keep this controller up and going until we were able to get things taken care of. Unfortunately, we pushed it too long and we lost the controller. So, but fortunately, we did budget for this, and so we're just asking to move along with it.
Rory, how much did we budget for it?
The original budget was for $86,800.
I believe that is part of the bond issue, so fortunately, I think I came up with the extra to fund the whole thing.
A few other benefits that we're gonna see from this, more accessibility. With the help of our IT department here, we're gonna see increased graphics on our systems down there to be able to better monitor the building. So there are some nice benefits that come along with just, it's not just the brains that we're replacing, we're also gonna get some functionality out of it as well. And then it sets us up for future phasing in future upgrades on the field devices that are throughout the building as well. So, any questions on that?
No?
All right, we've got a motion and a second. Roll call, please.
Schwartz,
Yes.
Grant,
Yes.
Kurttenbach,
Yes.
Leyland,
Yes.
Paul.
Yes. Item 9B, that the proposal received from Eco Water Systems, water liable for replacement water, softener, resin, and labor in the amount of $22,125 be approved, and for the chair to sign as recommended by Board of Facilities.
So moved.
Second.
All right, this is a unbudgeted item. Over the last several weeks, we have been seeing a decline in our water softness over at the jail, which has a substantial negative impact on the operation of the jail with regards to all the flush valves, the dishwashing machine, our chiller system. The guys have had to clean out, do more preventative maintenance as a result of this, and it's really been quite taxing, along with everything else that we have going on over at the jail. The last time we replaced this resin was back in 2018. At that time, they gave us, I believe, a 5 to 10 year lifespan, so we made it 7 years. What I explained in the email that I had sent to you, my recommendation would be to go ahead, change out the resin in these existing units this one last time. Then that would get us to the end of the useful life for the system in whole, which would be about 5 to 7 years from now. Then we'd be looking at budgeting for a new water softener system. The end of the useful life, these are resin containers. There's 3, they're very large. They do take 35,000 gallons of water a day is what they soften for that facility. So there is a lot of usage there. I'm pretty confident that we go ahead and make this investment and change out the resin at this time, that will get us to a point where we can appropriately budget to replace it. Any questions on that?
What would we be risking if we didn't do it now, do you think?
The only other option we would have is to look at replacing the unit. We do need the soft water over there for the functions that take place in that facility. The dishwashing machine, the amount of use that gets. Without soft water, we've tried additives in it. We just can't keep up without the soft water. Also with our cooling tower chemicals that go through our chiller system, that has a pretty negative impact as well. That water does get hard. And these are all things that the guys are dealing with over there right now because the system is producing hard water. So it really does play a large role in keeping things running smoothly over there.
Rory mentioned this was an unbudgeted item, but this is something that I could cover out of my commissary account easily enough to get benefits to inmates without any doubt, so I can cover that part of it for you.
Thank you.
I think you asked the questions, and gave Nate a minute to come up to the mic. Donate.
The next question is gonna be where are we gonna pay for it,
Yeah.
so that was great, thank you, Nate.
Just in time.
As if you planned.
All right, quick, before he changes his mind, we've got a resolution with a motion and a second.
Leyland,
Yes.
Schwartz,
Yes.
Grant,
Yes.
Kurttenbach,
Yes.
Paul.
Yes. That's everybody. 9C, resolution of the proposal received from Shoemaker Elevator, Denver, Iowa, for the repairs to the hydraulic elevator located at the Pine Crest facility in the amount of $54,055 be approved, and for the chair to sign as recommended by Board of Facilities Director.
So moved.
Second.
Yeah, this is a item that I explained also in my letter to you that this elevator has been down for some time pre-COVID. There's been quite a bit of discussion back and forth as to whether to decommission this elevator or bring it back into service. And with the projects that we have going on over at Pinecrest right now with the HHS moving up to second floor with their reception area, we felt it just made sense to provide a more of a streamlined access to their department through this elevator. And then it also provides a nice backup. Back this last week, we had, no, actually it was this week, yesterday already, we had the elevator go down at Pinecrest. It was a minor issue, but again, just another eye opener that when that elevator does go down, that cripples that building. So this would be a nice plan B to that. And so the amount that we had budgeted was $52,500. That cost has gone up to $54,055. So that's the amount that we're requesting today.
Roy, is the problem hydraulics or is it in the electronics?
It's actually in the lifting mechanism itself. They have to go in and replace the hydraulic lift system. It actually got a leak. So part of this project is they're gonna have to dig down, capture that containment where the oil had spilled around that shaft. And so that is part of this project that they'll dig around, recapture that, reclaim it, and then we're gonna be responsible for discarding that, and I don't have a plan for that yet, but we will figure one out.
Okay.
Excuse me, right, one more. If both elevators go down, is there anybody in the front, like entrance area, like if somebody comes in and needs to get access to departments on the second or third floor or anything, do they have a way to have direct contact with them?
Well, we have the guard there right now who can reach the department to have somebody come down and help if needed. I would anticipate that that would be the procedure. Once we're all said and done with our project, the health department will have their reception area down there on the main floor as well, if we do run into a situation where both elevators go down. And that's the other nice thing about this project is a lot of the flow, with the clinic, those services are all going to be on the first floor moving forward, so that will definitely help us. For the folks that are coming to see HHS, yes, they still will have to get up to second floor, but bottom line, there will be either a security guard, as there is now, or a receptionist placed there through the health department to help anybody that may need it.
Thank you.
Yep.
We've got a motion and a second. Roll call, please.
Schwartz,
Yes.
Kurttenbach,
Yes.
Leyland,
Yes.
Grant,
Yes.
Paul.
Yes. Item 9D, resolution to approve change order number 2 for the 2024 Washburn Sanitary Sewer Improvements Contract in the amount of a reduction of $2,512, that the chair sign the same as recommended by AECom Technical Services and Michelle Lee.
So moved.
Second.
So that project is virtually complete now. Assistant County Engineer Ryan Brennan and I met Mendel Gardell and some representatives from AECom out there last Wednesday, and the work was done well. I have a few photos if anybody wants to look down a manhole. But you can clearly see the pipes are working as designed now and not broken as some of them were before. So we're pleased with that project and nice to have that one done.
Roll call, please.
Grant,
Yes.
Schwartz,
Yes.
Kurttenbach,
Yes.
Leyland,
Yes.
Paul.
Yes. Item 9E, resolution to approve the final statement of completion and final acceptance of work for the 2024 Washburn Sanitary Sewer Improvements Project, and that the chair sign the same, and approve the release of retainage of $5,267.15 recommended by AECom Technical Services and Michelle Lee, Finance Director.
So moved.
Second.
call please.
Kurttenbach,
Yes.
Leyland,
Yes.
Grant,
Yes.
Schwartz,
Yes.
Paul.
Yes. Item 9F, motion to approve Spice of Egypt food truck to use Blackhawk County grounds on August 14th, 2025 from 11 a.m. till 2 p.m. In the southeast parking lot of the Pinecrest building located at 1407 Independence Avenue, Waterloo, Iowa 507.
So moved. Second.
Just here if you have questions.
Imagine? All right. This is a motion. All in favor, say aye.
Aye.
Motion carries. 9G, motion that the personnel requisition for an engineer technician, 1, 2, or 3, full-time, in the road department be approved as recommended by Captain Nicholas.
So moved. Second.
This would be a replacement for a technician. We are currently looking for, this would be our second technician we'd be looking for. We are trying to be creative, working with Gabby, getting more interest, working with HR, and possibly we will be working with Hawkeye Community College, perhaps getting an intern, such as we had a few years ago, to see if they would like to stay on with us permanently.
It's a motion. All in favor, say aye.
Aye.
Motion carries. Thank you. 9H, resolution to approve the hiring of National Property Inspections, Raymond, Iowa, to conduct a building inspection on a commercial property currently under evaluation by the county in the amount of $1,475, be approved as recommended by Rory Gemming, Facilities Director.
So moved.
Second.
Resolution, roll call please.
Leyland,
Yes.
Grant,
Yes.
Schwartz,
Yes.
Kurttenbach,
Yes.
Paul.
Yes. Item 9I, resolution to approve change order number 1 received from Peters Construction for the Pinecrest Building Public Health and Veterans Affairs remodel project in the amount of $31,849.87 for ceiling repairs, snow guard, sanitary sewer line replacement, additional shelving, and inspections. Be approved and for chair to sign for same as recommended by Rory Gemming, Facilities Director.
So moved.
Second.
Well, first of all, I apologize for getting an email out at 10:30 last night explaining some of these, but hopefully you guys had a chance to look at that. What I did is pulled out a few of the larger items off the list. There is a number of them, as you can see. Throughout the process when we're dealing with the construction of this size and in multiple locations, we've just, in an effort to keep things moving along and keep the project moving along, we do our best to try to minimize the number of changes, but ultimately there are things that pop up that are just beyond our control. And so I hope that the board understands our department, between Carol and myself, we do put a great deal of effort into making sure that what's being completed over at the project, any projects that we do, is completed and it's necessary and it makes sense. Just to highlight a couple of them, the sanitary sewer line, that was a big one that we ran into over at the VA. Unfortunately, we also ran into a similar situation at Pinecrest, but there is a bright side to that is we originally thought the whole stack, sewer stack from floor down to 1, we originally thought we were gonna have to replace that, and that would have meant bringing in temporary restrooms to that location. After we were able to open up some walls and do a deeper dive, they were able to make repairs at the exact location where they were leaking. And then we did a review of the stack to make sure that it was in okay condition before we put the walls back together, and it did come back that it was in good condition. So we dodged a pretty big bullet there. So again, that due diligence, I think, on everybody's part to try to do our best to keep costs down and to do the right thing as we're moving through these projects. So hopefully that, again, apologize for getting that out so late, but hopefully that helped kind of explain. This is a bit of a confusing project with regards to the different funding sources that we have, because it's ARPA, it's lost revenue. Michelle had put together a spreadsheet, which is kind of our guiding spreadsheet as we go through these projects to keep track of where we're at with contingencies and allowances. That's another portion that gets a little bogged down, but we do have allowances and we do have contingencies throughout these projects. Allowances are included in the contractor's bid. The contingencies are outside of the contractor's bid. We like it that way because that gives us control of that contingency dollar that's under our control. Either way, it would be ultimately under the board's control, but it just, having those dollars not in that contract sometimes makes sense. It just gives us more ability to track that. So, yeah, any questions on all that?
You answered what I was gonna ask, so.
Okay, which one was that?
Just about, I was just gonna ask about if we already include, that in the estimate or in the budget to begin with, as far as allowances for what if it goes over, for unexpected things that you encounter.
And I did put in there also our remaining amount that we have on both of those allowances and contingencies. We do know there will be a couple more coming. We do know that we have an emergency exit on the southeast side of that building. When we removed the flooring, we found some structural damage that ties into that exit. So that needs to be addressed, and we're still working through costing for that. And then we're also looking at the main vestibule, the main doors into the building. The approach to those main doors is questionable on whether or not it meets today's standards for ADA. So there may be something that will be required to do there. So I do know there's more to come, but yeah, this gets us up to this point, so.
Thank you.
All right, thank you.
Thank you. This is a resolution.
Leyland.
Yes.
Coates.
Yes.
Kurttenbach.
Yes.
Grant.
Yes.
Paul.
Yes. Item 9J, a resolution to approve change order number 2, receipt construction for the Pinecrest Building Public Health and Veterans Affairs remodel project in the amount of $83,326 for casework updates, plumbing repairs, patio and pergola changes, ceiling repairs, structural additions, flooring underlayment, additional demolition, electrical revisions, and door hardware changes. Be approved and for the chair to sign for the same as recommended by Lori Giving, Facilities Director.
So moved.
Second.
Just echo what I said previously.
Roll call, please.
Grant.
Yes.
Kurttenbach.
Yes. Who'd you say?
Kurttenbach.
Couldn't hear over the noise.
Yes.
Yes.
Leyland.
Yes.
Schwartz.
Yes.
Paul.
Me too?
Yep. Yes, yes. Couldn't hear that. She looked this way, I thought, okay, yes.
Item 9K, discussion of possible board action to receive results on the opioid settlement funds gap analysis and recommended priorities, and to establish a committee to develop an application process for Blackhawk County opioid settlement funds.
First, I want to thank all the health department, all the community partners that serve on this committee, helping get us this point.
A couple of them are here.
I was gonna say just a portion of that, yeah. All the people that helped, that was great.
Okay, good morning board, Caitlin Emmerich with Blackhawk County Public Health. I was last here to talk about opioid settlement funds in March of 2025. At that time, I presented the work of the subcommittee that was working on doing a gap analysis with current resources and activities and funded activities in Blackhawk County. And at that time, I notified the board that some of the gap analysis would need to be revisited due to a few things that were in the works. One of those major things is behavioral health realignment, which took effect July 1st, that I'll talk about a little bit later. and kind of receiving grants and contracts and figuring out what was going to happen from the impacts of that behavioral health realignment. And so all of that work has been done, updated the gap analysis, and we're ready to present the results to the board for your consideration. Okay, so just as a refresher, as part of the opioid settlement agreements, we do have limitation on what those funds can be spent on. That's outlined in Exhibit E of the settlement agreement. We talked about this, I think, every time that we've had this presentation, so I'm gonna go pretty quickly through it. There are core strategies that are asked to be prioritized as part of the settlement funds distribution and allocation process, and that's listed on this slide. But I'm gonna move forward to an update on current opioid funded programs. And with us in the room is Vicki Mueller. She's the Executive Director for Pathways Behavioral Health. She's here today because many of the projects that are funded to do this work do go through Pathways, and this first one is one of hers. So I asked Vicki at any time if I'm saying something that's not what she is not the truth or needs correction, to just interrupt me and correct it. So first of all, the County Substance Abuse Project, this was a funded activity through June 30 of 2025. Beginning July 1, the project was not re-procured through the Administrative Service Organization's Iowa Primary Care Association as part of the behavioral health realignment. So in FY25, this was a funded activity to provide prevention, evidence-based programming in the school system for opioid prevention. As of right now, this project is not funded.
Can I add something?
Yeah, absolutely.
Sorry.
You might as well just
make-
come stand by me.
Yeah, I just wanna make sure it's clear, it wasn't funded because we did something wrong. They took
Yes.
away the county grants for all the counties in Iowa. So,
Absolutely,
just
yes,
to be
thank
clear.
you for clarifying
Yes.
that, yes. The next couple are, I'm gonna get through a couple of mine and then they're yours
Okay.
again. So, the Overdose Data to Action in States project, the OD2A, that is a project that is funded through Iowa Health and Human Services to Black Hat County Public Health. We did receive an amendment for FY26 for this year, so there's no changes on this project for this next fiscal year. The FR-CARP program is one that's been in existence for many years, and that one is scheduled, the project period is scheduled to end September of 2025. So Iowa HHS is waiting for information from SANSA on whether that funding will renew. Those are federal funds that come to the state. And I think as we're all really well aware, our federal funding is not clear for many programs, and this is one of them that we're not clear on the funding for. So that is the update on FR-CARP. This is another one that Pathways does the services through a subcontract. And then the state opioid response grant is another funded activity for opioid prevention work. Vicki, I don't know if you wanna just talk about
Sure,
the
it's
changes.
primarily opiate treatment. What we do is we provide services for clients coming in, case management, things like that for 6 county service area. There is a prevention component that's very structured. We have to follow the state guidelines on it. It's not a lot of school-based services or anything like that that we're providing for that.
Yeah, and I think.
And they are doing a reduction, we just found that out last week, they are reducing the funds that we get from that by about $100,000 starting October 1st, because it's on the federal fiscal year.
And a couple of notes that I had to the slides here based on Vicki's comments back to us is that the funding for patient relief runs out about halfway through the project year, is that correct?
It always runs out, and usually what that patient relief is things like we pay for the medication, for like methadone services, and then also for recovery support services, which are things like gas cards or first month's rent, things that help people get back on their feet. And since they're cutting our funding a little bit, that's gonna run out even sooner.
And then the other change is the outreach and engagement funding change that's happening beginning in FY '26, that they're not funding the outreach and
Right,
engagement.
they're not funding outreach and engagement for any of our services. We used to have about $70,000 a year, but apparently the administrative service organization that's for the state will be doing outreach and engagement, but it's not clear how that's gonna happen.
And then the next slide is actually a new one that you haven't seen before. It's a couple of Medicaid-assisted treatment resources that are available to us at Black Hawk County. And so the first one is a technical assistance grant. You're still here, okay. I think it's Jessica that does this work.
She's working on it.
Yeah, but just kind of an awareness to the board that this is something that that we are, have the ability to take advantage of. The funding is for technical assistance, not the medications or the other costs, but it is a resource that we have that we can take advantage of. And then the second medication assisted treatment related project is the University of Iowa Addiction and Recovery Collaborative. They can come in and provide training for providers on prescribing practices. This is also new since March. So this past legislative session, the Iowa legislature passed House File 1038 into law. And then it was signed into law on June 6th that authorizes $29 million in appropriations in the FY25 fiscal year to the Iowa Department of Health and Human Services, and it created a list of allocations. I listed here on the slide the allocations that impact Black Hawk County or are to organizations that serve Black Hawk County. So the amount listed on the bullet point is the amount that's distributed across all of the providers. So that first one, $2 million for Iowa Primary Care Association to contract, that goes across, all of the providers listed there. So that one is Pathways.
Well, it's roughly $500,000. I have a meeting next week with Iowa Primary Care, but it's specifically to be used for peer services. So for peers out in the community, not for treatment services, just for peer recovery support services. And they're gonna give me guidelines on what specifically it can be used for. It's looking at some sort of connection with emergency rooms and peers within emergency rooms. I'm not sure how that will work because I'm not sure we have hospital buy-in, but the state decided on how to spend these funds, so.
Are those split
Yeah, it's
evenly, so it's not necessarily based off of?
As far as I know, I asked that question and the response I got from the state representative who was speaking to me from Iowa HHS said, yes, I think so. So I'll find hopefully more out next week on that. Yep.
Okay. And then the other funding from the state opioid settlement fund that were outlined in that allocation were $4.5 million to a variety of agencies for recovery communities, to establish recovery community centers. The one impacting Black Hawk County or housed in Black Hawk County is the Center of Attention. And then $1.5 million for recovery cafes, and One City United was outlined as the recipient for that one. And then I also added, not specifically to Black Hawk County, but there is also a note in that allocation that $3.3 million for nonprofit organizations to submit proposals for HHS for the development of recovery housing. So that, obviously that hasn't happened yet. It could be, an applicant from Black Hawk County, but not necessarily. That's just kind of a broad.
And just to be clear, the recovery housing is peer-led organizations, so Pathways wouldn't qualify, or an agency that does treatment services generally wouldn't qualify for that, so.
And then a reminder of county opioid settlement funded contracts. There are two. Pathways has one that goes through the end of September for Black Hawk County Jail Services. And the County Substance Abuse Project, which I mentioned, ended in FY25. That was the second one. And then One City United is the second of those two contracts. I just want to point out, One City United's funds are fully expended, and they have been for, since January of '25. And the contract for jail services ends at the end of next month, so that one's coming up soon. So depending on the action item that comes out of the discussion today, I don't know if the board would want to consider an amendment or something like that. I'll let Nate and Vicki kind of talk to that, but I just wanted to point that out. Okay, and then I'm gonna hand it over to Michelle for a few slides to just give a quick update on settlement funding.
This slide is one you have seen before in this presentation. I left it in just so you'd have a frame of reference, I guess, for the next year. Our cash balance at June of 2024 was almost 1.1 million. We spent about 217,000, and then we received a total of almost 642,000. Then for FY25, we only received 329,000, and as you remember, we've talked about the fact that the entities getting settlements are setting up a payment plan, and some are paying all up front, some are spreading it out. So the actual cash payments are going to vary. So far this year, we only spent 175,000, primarily due to One City's contract being fully spent by the end of January. So at the end of June of 2025, we had a little bit more money in the bank, 1.25 million, not a lot. And then the next slide we'll talk about projected. This is based on information that the National Opioid Distribution Settlement website has provided to us. So this should be fairly confident that we will receive these dollars. And the first, I just reduced it to 4 years from 5. I was giving you 5 years a year ago, but to stay on that method, I'm showing you each year over the next 4 years, we're likely to get about 440,000. The next 4 years, 260,000 a year, and that last 5 years, 155,000. That does include a new settlement for One Sandoz, I think was the name of the company. There are some others out there that are being worked through, but we have received no information about what our potential share may be. So as of June of 25, our total future estimated payments now are about 3.8 million.
You said this does not include the Sandoz?
It does
It
include
does,
that,
right.
yeah. I'm expecting and have that included likely in FY26. And they told us that was likely to be a one-time payment, like 166,000, so not a huge amount, but we'll take anything, right? So and then I just was trying to give you a base of reference a year ago, that if we continue to invest 250,000 a year, and that's completely up to the board, you may choose to do more or less than that, but if we did the 250,000, the projections we have today, we could do that for 14 years at least, maybe to 15. So just depending on what the board wants to do. I think that's all I have for them.
And so the next section is an update from the action plan subcommittee, and it's really an update of the gap analysis. But as a reminder, real quick, the background of the subcommittee is we moved forward with the subcommittee as it being a subcommittee of the current existing Cedar Valley Substance Abuse and Overdose Prevention Coalition. That coalition is facilitated by an employee at Pathways, and it just made a lot of sense to have that be a subcommittee of an existing coalition. And they met monthly from October to February of 2025 and have kind of been providing information via email and informally since then to provide an update on the gap analysis. So much of the gap analysis stayed the same as was presented in March, but some things did change and are updated as a reflection of mostly behavioral health alignment. So the gap analysis performed by the Action Plan Subcommittee does include existing services that can be enhanced, as well as new services that could be added for each of the top ranked activities in the Schedule A list. The first item I wanted to just talk about real quick is the federal and state funded programs. We've seen a little more volatility in the grant funding from at the federal and state level, and so I just have a couple of notes about that. Predictability of that funding only goes out as far as the contract period. So that's just kind of something to keep in mind for that. I had a note about the state opioid response grant that has changed, where the funding is no longer included for the outreach or tabling in the engagement, which is the pre-appointment call through, supporting salary and fringe to do those pre-appointment calls to identify barriers, and note provided by Vicki.
It's actually not the state opioid grant, it's the IPN, Iowa Providers Network grant. It's okay.
That's why you're here.
I know, that grant doesn't exist anymore, so.
Okay. But I had just something to highlight from the gap analysis, that there is a concern about the no-show rate increasing due to that. And then the county substance use project ended in FY25, as we discussed, due to behavioral health realignment and kind of the different way the administrative service organization is handling that. And FR-CARB ends September 2025 unless we're notified otherwise. And then in terms of locally funded programs, we have, obviously opioid settlement funds that are, contracts are in place right now. And the sustainability over time is something to consider for that, for those programs. And then legislation, Medicaid reimbursement is something that is being discussed or has been enacted upon for legislation, so that's another kind of threat to the system when it comes to opioid prevention, treatment, and recovery. Okay, just an update on behavioral health realignment. The administrative service organizations really have discretion on the programs they support, like we saw with the county substance use grant. And so there are some changes with the behavioral health realignment that are noted here. And probably Vicki could answer questions on these talking points, but safety net management information system, which was created to replace region and integrated provider network funding, and provider reimbursement rates were reduced as part of that, which could impact access to treatment providers. And then in addition to that reduction, people who are underinsured are no longer covered by this funding. Is there anything additionally that you want to mention?
No, I just want to say that this impacts all of behavioral health providers in the area. Mental health especially, they reduced those rates down to 85% of Medicare rates, which was pretty impactful. So that's just something to keep in mind, that many providers will be hurting but still required to see anybody who walks through their doors.
And then the next two bullet points are information that are coming out through some work happening with the Overdose Data to Action Grant, the Public Health and Safety Team, or that FAST safety team. There's a note from Sarah and the team on that compensation for community members at large or sectors where their role doesn't necessarily support their participation in that because they're paid, for reimbursable services or something like that, that the work that they're doing is very beneficial, but they might not be able to do that work if they're not supported in it. Whether that's, whether their employer is allowed to support their participation in that and be able to pay them, or the ability for compensation to be provided for individuals to participate in that committee. And then the second bullet point is overdose surveillance through ODMAP. That's just kind of a capacity and infrastructure bullet point that we're looking to increase participation from first responders to do some data reporting on non-fatal and fatal overdoses to be able to kind of automate data with electronic medical records that can increase surveillance for opioid events. And then the last couple of points that I wanted to mention on the gap analysis that are either an emphasis or are new. Media campaigns have the potential to increase awareness of current programs and impact multiple strategies simultaneously. So in the gap analysis, media campaigns is one of the strategies that could be prioritized. We found that had cross-cutting impact on a couple of different strategies. For example, the Family Resilience Program provided by Unity Point. Katie noted that, a lot of times she's not sure that there's awareness of the program that they have. We talked about that with naloxone availability. There are many programs that offer naloxone availability in the community, and a media campaign to highlight where to find those might be beneficial. And then just kind of an overall observation that state opioid settlement funds have more of an emphasis on recovery in terms of allocation of the funds available. So maybe a unique opportunity might exist to invest in prevention and treatment to allow that broader impact on continuum of care across the whole spectrum. And then just a refresher, the priority recommendations that came out of that gap analysis and kind of the voting by the subcommittee include strategies within each of the prevention, treatment, and recovery components. This has not changed from the March presentation. They include in prevention, funding and training for first responders to participate in pre-arrest diversion programs, post-overdose response teams, or similar strategies that connect at-risk individuals to behavioral health services and supports. In the treatment category, providing evidence-based treatment and recovery support, including Medicaid-assisted treatment for persons with opioid use disorder and co-occurring substance use disorder or mental health disorders within and transitioning out of the criminal justice system. And then in the recovery section, expanding warm handoff services to transition to recovery services, broadening scope of recovery services to include co-occurring substance use disorder or mental health conditions, and then finally, providing comprehensive wraparound services to individuals in recovery, including housing, transportation, job placement, training, and childcare. So that is the update on the gap analysis and kind of where things landed after some of the new information coming in occurred. The action item component of this agenda item is that I'm hoping for discussion would be a funding opportunity component. And so what I am hoping there can be some discussion around is how to structure a funding opportunity to be in alignment with the recommendations based on the gap analysis and the priority out of the Schedule A. That would allow guidance and structure for applicants that want to apply for those funds, so they know, what the funding opportunity priorities are. Transparency in that funding cycle. Michelle mentioned, if you did $250,000 a year, this is how long it would get you. That would provide transparency to potential applicants on how often funds are going to be available, how many funds are going to be available, things like that. It would also provide guidance and structure to you as board members, so you could, be able to set direction in alignment with priority areas, have clear project proposals to community members that might want to discuss with you those things. You'd be able to have see a budget description as part of the applications for the project period. You could ask for a sustainability plan for proposed projects, and you would be able to look at evaluation criteria for the effectiveness of the proposed projects that might include number of clients served, measurable objectives and performance metrics, and utilization of evidence-based practices. For example, you could use different evaluation metrics if you would like. So the action item that is up for discussion, I guess, would be to develop a committee to design that funding opportunity application in alignment with the allowable remediation uses listed in Exhibit E, the core strategies listed in Exhibit A, and that reflect the identified priorities based on the gap analysis from the subcommittee. That's all I have in terms of prepared slides. Are there any questions, comments, other thoughts?
To get conversation started, I would propose a committee for developing the application be made up of maybe 2 folks from the health department, Colleen, Shipper, Michelle, and then open to others from there, and I had a question for the experts in the room, as far as whether we're trying to spread this out evenly over 14 years or is it more front-end investment more impactful? I don't know.
I don't really know how to answer that because, again, my contract right now are all the behavioral health contracts, like with the ASOs, are year to year. So I'm not sure how to respond to that for sustainability reasons. I would hope we come up with a more stable system as we move forward. Because traditionally it was a 5-year grant and things like that I could answer, but right now I can't really answer that question.
Let me ask a question, Chris is here. Can you give us an idea how many people are in treatment any given day compared to through the years? Are we seeing an increase?
We are seeing an increase in both mental health and substance abuse treatment. For example, in 2021, we saw like 5,200 people. And in this fiscal year, it's closer to 7,000. I haven't run the exact numbers yet. My annual report's not up to date, so I haven't done that one yet. So, yeah, it's going up.
Significant.
It's going up significantly.
Sorry, and I know you just took it off the screen, but
Oh, I can put that on the screen. I got ahead
Can
of
we-
myself, thank you.
can we go back to that, I think it was in Michelle's slides that had the payment schedules?
Mhm.
Cause that was my question to Chris, was does it make more sense for us to front load? Or if we're looking at 14-year process to expend dollars?
I just wanted to point out that the state has those opioid funds also for like the recovery support services, and I'm not sure how they're gonna spend those down. I mean, they just gave out 29 million statewide that's supposed to be spent down by 2027. So that's for like peer services, recovery cafes, not prevention and treatment. It's for those services. So I'm not sure what they're gonna do after that. So again, that's something to take into consideration as well if you're thinking about front loading or I can't tell you I don't know what I would do in your situation.
The uncertainty, I think, weighs heavily on what you do up front as well as consistency, but yeah, there's a need.
And there's always
That would be-
uncertainty with state dollars.
Yeah.
I mean, not always, but recently.
Gonna be.
For a while more
So we're getting about 3.3% of, the state's getting half
Mhm.
of the total amount allocated to Iowa. So they certainly and should have a larger pool, I guess, but yeah, so it appears their initial drive is to try to fund some of the facilities, which may be the more expensive thing to begin with, I don't know. So I don't know what their future planning.
Yeah, they're trying initially to start up because they had a big focus this next year on recovery support communities, recovery peer services, because we didn't really have a strong recovery support services agencies, so that's what they're funding now in the next 2 years is these peer agencies run by peers who've been in recovery.
Can you all talk a little bit about prevention services? What's that sort of nuts and bolts look like?
Well, traditionally, we've got several levels of prevention. We're out in schools, in the communities. We help with we have programming, like research, evidence-based programs that we do in prevention. or in the schools. And then we also do programs helping people, helping agencies and workplaces tighten up their policies. So if somebody gets picked up or is struggling with substance abuse, we help them write their EAP policies and how that's gonna happen. We also do some some media out in the community. We teach DUI classes. We do, for kids who get picked up for like a substance use offense, we teach youth diversion classes, that's part of prevention. So, and right now since we lost that county funding, this is just for pathways, I'm not sure there's other substance abuse prevention in the area, but for pathways, we had to reduce some of the schools we're gonna be able to go in Blackhawk County, unless, I said something to Supervisor Leyland about that.
The one that ended, as far as the amount, that contract that ended, that served how many and what did that?
That served about 300 students, so I found a way to reduce that down a little bit, so it's less than the 19,000, it would be 13,000 that we would need for this coming school year, so we could be in the same schools we were before.
And then I would just add the couple of pieces of prevention that are in the OD2A grant are provider prescribing practices. Vicki mentioned policies, that's kind of a policy change to try to control the number of opioids into the system. And then surveillance as a component of prevention.
Most of the time that we have grants from the state or from the ASOS, it's very scripted on what we're allowed to do with it.
Vicki, on the schools, I assume there's some algorithm that goes into how the schools are selected. How are those schools picked?
The schools are picked based on, we offer it to every school.
Yeah.
And then it's picked on whether or not the school wants to follow the guidelines that Waterloo District has outlined. It's a little bit of teacher work, and some of the schools aren't willing to put that in.
Is it just primarily Waterloo schools, or are we in other school districts?
We're in Waterloo, Cedar Falls, Hudson, we offer it to all the schools in Blackhawk County, Dunkerton. All the schools in Blackhawk County.
For the schools that haven't expressed interest or willingness to do it, I mean, have you gone to like the school board or
We haven't
superintendent?
gone to the school board. What the issue is it doesn't require this, but the school wants, or the district would like us, for example, Waterloo Schools wants us to have active consent. So that means that on the teacher's end, they have to collect consent forms from the parents. And that's a little bit not easy to do. But since we're not, it's not passive consent, it's just fine with something like this, but that's the holdup with many of the schools, because it's difficult to get parents to turn stuff back in.
I hate to see that program come to an end so abruptly like it did, and then us not have this process in place for a while yet, as you're only doing it. That might be something I think maybe the board would want to consider separately from maybe just the thoughts on it.
What was the dollar amount that we were in at?
13,600 or something. It was just shy of 14, or maybe it's 13,060. 13,060. For that one.
Probably need a separate agenda item.
Something
today,
another
but
day, but
You could put that on next week.
And a little more information on that.
Yeah, and I would like maybe to consider also an amendment to kind of extend the jail-based services that we're currently providing just for, until this process is in place, because I'm sure Nate wouldn't like that to end either.
No, I'm 100% in support of that. That's been, I think, about 5 years now we've had this going on, and it's been a great addition. We've got an office created just for pathways. We have one full-time employee in the building, and then 2 of the counselors come in at 4, I think, between the 2 of them.
Yep.
So they're seeing people, reaching people before they get out, having services set up before they get out, just identifying a lot of people that would otherwise be missed. It's been a great partnership for us, and we definitely don't want to lose that.
Is that in October? Was that?
That ends
September
September.
25th.
Yeah, end of September.
End of
basically.
September.
Okay.
So, I mean, I'm not asking to get away from the application process, but just an extension until it's set up.
Could I invite myself to walk through what that looked like? Pretend I'm an inmate for a day, like 2 hours maybe. Just come through to see what that whole pipeline looks like. I'd be really interested.
Yeah, as far as how Kelsey sees them.
Kelsey does the care case management, and then if they need treatment, we do screenings, and Nate and I are meeting on Thursday to talk about some other stuff, I guess.
Yes, but then, and it's nice, they fit in nicely with our social work, both Jessica and Sarah Geiger, and then after they form a pretty strong three-headed monster of a team there, so. I won't pretend that I know all the ins and outs of how it works, but I know that it does work, and they all speak highly of all 3 points of the triangle on it.
Anything like an undercover boss kind of thing?
Well, no, I just wanna know what that looks like. You know, cause obviously I have one perspective, but I'm always curious how those things work on the inside, and there's all these moving parts.
Sure.
So, alright, I'll be in touch.
So for committee, how do folks feel about a makeup?
Could you repeat?
I would have Caitlin, one additional person from Health Department, Colleen, and Michelle as a start.
I think there was one of her slides she mentioned, there were 18 of us at each meeting. The problem with that was all 18 of us wanted a piece of that pie.
Right.
Yeah.
So we were all kind of fighting for it, so I think this is where it kind of needs to get kicked over to more nonpartisan people that aren't all 18 of us saying, that's mine, that's mine, that's
Yeah,
mine.
my understanding is the health department doesn't intend to apply for
Correct.
this one, so.
Correct, yeah, I mean, the prevention funds, public health is so centered in prevention, the prevention funds are awarded to Pathways from Iowa HHS, and I think that's appropriate to keep it that way. The other services that we have that link to substance use are kind of, we're not by choice, I will say, I don't know the better way to say that, but the FR CART funds were attached to our emergency preparedness contract, and that's kind of how we ended up owning those FR CART funds. And the OD2A grant, the state health department wrote into their federal proposal that they would contract with local public health agencies. And when we pushed back and we said, well, we're not the substance use professional in our county, they said, well, we either contract with local public health or we don't contract with Black Hawk at all. And so, that's kind of how we ended up with the OD2A funds. And so, I don't intend to apply for any of those funds, and so I'm fine serving on the subcommittee or on the committee to work on the project proposal.
Do you see any other parties being helpful to Chris's kind of designation of committee members? There's any kind of a outside view or
so I will
perspective?
say, the person that I would like to join me from a public health representative would be Ty Burkhart, the deputy director. She had experience working on this in Buchanan County, and so I'd like to tap into her experience with that. I think the financial piece, having Michelle, is important. And I had a chance to talk to Colleen yesterday and asked her if she would be okay from a, kind of a perspective of somebody that deals with vulnerable populations and things like that, and she agreed. So
But the 4 you think would cover
I think that's
well?
okay. I mean, I don't know of anyone else that doesn't intend to apply that would be, have experience in funding proposals. I might be overthinking,
That's what,
skipping over
that's,
some
I
of it.
mean,
I think the
could
board-
certainly be added at some point too, if you
Yeah.
found there was something like that.
Yes, definitely.
No, that's
And,
great.
with a small group, hopefully we'll be able to get it done quickly. And
Good luck with that.
that is always helpful too with efficiencies, yeah.
So the application and process, for the most part, then you're willing to, all of you kind of work on it.
Yeah, and I know that there's a process that's in development for the community development funds where, the board is scoring those applications. If that's that you wanna go, I think that makes a lot of sense, but we could at least, put the guidance documents together and things like that.
So is that a motion?
Yeah, I'll make that motion.
I'll second it.
Got a motion and a second. I did have one additional question is, would we envision that the application would change if we decided to go with a more, instead of a balanced 14-year approach, if we went closer to the annual allocations, would we anticipate, or maybe just leave that up to the committee of either proposing different rubric and then allow the board some time to think through what philosophy we wanted to go, if we wanted to front load, or basically as dollars come in, we expend them versus stretching them evenly.
I'd certainly like to think we do it to be determined, kind of, we could do that at a later time, maybe
But I
we
think-
just wanna do that.
But I wonder if the application itself would change if it was 250,000 to expend versus 440,000.
Well, we could go higher, we could do a front load without doing it real heavy, I guess, because I think it seems like time is of importance to what could change, whether state or federal or program wise, I guess, I don't know, it just seems like, well, yeah, I wanna be flexible with it as far as not locking us into something, but.
The other thing, that I would put out there is, did a gap analysis and did a prioritization now, but, I think the funding slide went out over the next 15 years, right? Certainly there would be another assessment and gap analysis done
Yeah.
before 15 years goes by. I think
Yeah.
ours is on every 5-year cycle, on a 3-year cycle. So probably in 3 years, we would, do that process again.
Perhaps unless there's a need, if something changes, like contract wise with all the behavioral health providers. I mean, they're only on yearly contracts right now, so.
Yeah.
So,
I would also perceive that we might wanna change that if we receive notification of a fairly large settlement. I would think that would change the circumstances and we'd wanna look at that again.
Seems like there's some local providers that are still in question with primary care and what kind of services they're going to have or what are gonna be discontinued by the year end.
Correct.
And so that timeline could be important too. So how would you, do you see that as prohibiting something we'd wanna start with, I guess? Or hindering, I don't know.
I'm just, and this is through a very different grant application processes that I've been a part of, but, going into some of that grading rubric, if we had double the funds, I think our priorities might slightly change. But again, that's not from this world, it is from
Yeah,
other stuff, it's really just a question of whether there would be benefit for a second version of the application in that rubric for us to have some time to make a decision of which direction we wanted to go as a board, if we wanted to front load
Yeah,
it.
I think we could do that. We could maybe look at, and when I say we, it's really Michelle that's gonna do this, so you could just agree with me. But we put together what it would look like for the same amount of funding every year versus a phased out approach, to really also encourage sustainability. When we get to year 15, it's less than years 1 through 5 maybe, or something like that.
I was thinking something like maybe the first 3 years are kind of front loaded, just thinking like the opioid crisis is here now.
Yeah.
Hopefully 15 years from now, we're looking at different, but I don't.
I think so too.
What do you think is causing the addiction? I know there's a lot of different things, but people like, and that's maybe an unfair question, but like the high ACE scores typically probably factor into that.
there's some of that, the ACE scores do have an impact where people are experiencing more trauma. There's things going on there, overprescribing, I think was a big thing, and I think we're starting to impact that right now, so people have more access to substances, and when people have more access, they're more likely to utilize it. So that's a problem right there. And just not enough resources, not enough prevention services in schools that were being fully funded. I mean, that's still going on. That there just wasn't enough information that people had about what would happen. So there's that. And then, so there's some of the people that have trauma, but some of the people just use too much too often, and that's what happened. so.
As far as like prescription and stuff, I think.
Perhaps, yeah, they just didn't have the information that they needed. I mean, it's an easy fix if you've got a pill bottle sitting on, and you're paying.
Yeah. Well, it's on the label, Becky, and
I understand that.
I'm kidding, I'm kidding. I know it's ridiculous.
It used to not be though.
Yeah.
So, there's that.
I'm just thinking of like a root cause attack
I think there's
strategy,
multiple
you know.
root causes. And it would be different for each community too. I mean, why is it happening in small town Dumont, Iowa, compared to why it's happening here in Waterloo?
Right.
There's different root causes based on the community.
Have you given any thought as a committee of what kind of a timeline you think this would take even to put some of the parameters in it? I know it can be overwhelming sometimes to do that, since we
Well-
know there's such a need to get this out into the community, but.
I haven't actually asked Ty.
Okay.
So I probably
She might
have.
Well, I was just
Is she
thinking
online?
from an update.
It's online.
No, I was thinking more as an update to us, even
She's probably
too, if
texting me
you
right
look at this and redesign it or wanted to redefine it or see something you would want to front load or upload, maybe that'd be different, but.
Do you have thoughts on that?
I think we need at least a few weeks
Yeah,
unless I had something already baked, but
Thinking 2 to 4 weeks is kind of what I'm thinking.
to at least come back with
Yeah.
some ideas.
Might be easier than us working on it.
Can you forward us the
There'll be a window
slides?
for people to apply to the committee, so
Yeah.
they're gonna need time to get you.
We may want, I think the board may
Yeah.
want to consider, it's hard to open that door because others will ask, but we could offer short-term amendments to providers that we've already funded. That would be, you know,
That's
we have
another door.
we have a contract with Pathways, we also really have one with One United, although they used all their funding, and he does contact me pretty regularly about when we're going to open that window. So if you feel that you want to open a short-term amendment process for the existing, I think that would make some sense, and then give us a little more time to come back to you.
Actually, I was gonna ask if I did an agenda request for the next week or two, looking at the end of the year, do you want a 6 month? I mean, what it's gonna take to bridge that gap till we can go through the formal process with it. By the time the committee forms and then they have an application process and then they sift through those, it's, I would think, the end of the year is pretty.
I think, let us get together, maybe we can give you an update next week of how long we think that amendment window should be, because I don't have a sense of that right now, unless Caitlin does.
Well,
I know we need some,
I know that September 30th is gonna be
Yeah,
here
that's-
before we know it, so I would say
we need something,
at least something, but, you know,
whether it's 90 days or.
yeah,
Get
and
us through the end of the year at the minimum, and then
in writing a proposal, I mean, usually you give agencies a month, you know, a 4-week period to put their application together, so, if you shorten that up by too much, you're gonna run the risk of them, just people not applying, because they don't have the capacity to turn something around that quick, so, you know, I think that's a month just to allow people to write and submit after they receive the announcement, and then there's the scoring timeline, you know, to be able to score and make those decisions and submit the awards, so, I mean, that's a couple months right there.
We're at least in January.
Yeah, some, you know, maybe through the end of the calendar year or something like that.
It was just a proposal. I meant for us to actually think about the
Yeah.
timelines and what was all expected, so.
So if we can
Yeah.
maybe ask the committee to just make some recommendation officially next week, just for you all to not have to make a recommendation on the spot. And in terms of the short-term stuff. And yeah, do we want the committee to be back to us with an application by September 9th? That gives them a month.
I think if we're not adding additional members, that is doable. If we're adding additional members, then I think, I don't know how long that would take to add additional members. You know, if you're okay with the 4 of us being the committee, then I think September 9th is reasonable. If we wanna add people, then we might need to go out a little bit.
I don't know that we were thinking of adding, it's just.
Okay,
we had in
I thought I'd
addition
heard
to
that,
Chris's.
so I just wanted to
No,
clarify.
in addition to
Okay.
Chris's suggestions of the.
Yeah,
of the
okay, yeah, then I
proposal.
think
It was
that's
just-
reasonable.
I'm thinking that's quick, but I'll rely on you.
Okay,
We are coming into heavy,
okay,
You're in
maybe
audit
1 week
season.
later, what's the next Tuesday after September 9th?
I think that would help.
So the 16th is what you're
The
asking for,
16th.
Michelle?
Yeah.
Do you,
So then presumably, just thinking through the rest of the year, that application would go out shortly thereafter, open up through mid to late October, and that would give you November to review those applications and get the recommendations back to the board by December for a January 1. That sounds idealistic, I'm sure, but
yeah, and I'm wondering, because we're in the middle of fiscal year, if we might wanna discuss, doing some alignment where the first cycle would be a little bit, I mean, I operate on a fiscal year calendar, I know that there's, you know, people are on other calendars, but, you know, maybe where that first project period would be a longer project period to get a full fiscal year and then make up the rest of the the one that we're in, possibly, or, I mean, we can just discuss that and bring back some recommendations, but.
well, we've got a motion in a second for Caitlin, Ty, Colleen, and Michelle to establish the committee, and I think enough discussion at least to provide some guidance. All in favor of creating that committee?
I,
Motion carries.
I do have one additional clarification. So next week, do you want us to come back and give you a timeline update or no, since we just worked out
Well, I think for the
the 16th?
for the short term, that we had talked a little bit about the schools piece, the jail piece.
Oh, on the amendment recommendations?
Yeah.
Yeah, okay.
Thank you. All right. Item 10, any reports or information from the board? All right, otherwise, a motion to adjourn?
so moved.
Second?
All in favor, say aye.
Aye.